You know, someone called me up yesterday and mentioned, and they said, well, it was actually Friday, and they said, who actually can come to the clinic? And I said, well, keep in mind, this is the people's clinic. And that's really what I want people to feel. It's the people's clinic, the people in Lexington who we're so fortunate to be able to serve. I just quickly want to say, first of all, I'm going to list just, and you always will be remiss and forget, but I want to just acknowledge, first of all, the patients who call Health First Bluegrass their medical home, and they come to us and trust us with their medical and dental and pharmacy care. The staff of Health First Bluegrass, who absolutely are a 120 strong team of people who, in fact, as I said, I literally stand on their shoulders every day. Many of them who are behind us today, our board of directors, our initial board that stuck with us, our new board that joined us, Mayor Gray, and I want to be very honest, when the Health First Bluegrass initiative was, are we going to build a building or not, and the mayor says, let's get a building built. Our people need a building, and I certainly want to acknowledge him. Certainly we would not be here without the strength of Congleton Hacker, EOP, and Strand as our construction manager and our two engineering groups. There's times where we've been trying to get through it, and basically they said, if you're going to go and you're a go with us, we're going to stick with you. And they have stuck with us throughout all of this, and God bless each of them, and I mean that. And to our landowners who actually work very hard with us to enable us to put together quite frankly, a financing package that's going to make this a reality. And then I'm going to end, before I introduce the mayor, by just giving a special thanks to a gentleman that has meant so much to healthcare, not only in Kentucky, but in Lexington, Fayette County now more recently. And that's just a special reach out to Dr. Rice Leach for just sticking in there and saying, let's get this done. I would be remiss also if I don't say to Jack Cornett, wherever Jack Cornett may be, as that old saying goes, and I do think he's still with us here, but God bless Jack Cornett, because he has been a real trooper. With that, I just want to say thank you. I'm going to turn the podium over to our Mayor Jim Gray, who has been a staunch supporter and has never blinked an eye at any time when we said, let's make this happen.
Steve, Jack was right behind you. Right behind you. Listen, good afternoon, everybody, and thank you, Steve, and members of the Health First Board, the medical staff, and as Dr. Davis said, the patients. It's good to be with all of you here today to mark a milestone for healthcare in Lexington. I want to also recognize Councilmember Harry Clark, and Steve's already recognized Dr. Rice Leach. It's good to see you all here as well. Well, with this facility, all patients, regardless of income level or ability to pay, will have access to affordable, high-quality health care. And that includes access to cancer screenings, access to dental care, and a pharmacy, all in one convenient location. This Health First Primary Care Center represents a wonderful infill redevelopment project as well for the Southland Drive Business District. It's a special place here in Southland, in Lexington. Just last week, I was on the Jack Patty Show, and several folks called in wanting to know about activity happening in the Southland area. Today's groundbreaking for this project has been a long time, many of you know, in coming. Larry, you said that just a minute ago. It's been a long time in coming. But we all know that the human spirit really overcomes adversities. And I want to thank several people who helped make sure this project stayed on track. Steve Davis, Dr. Steve Davis, once he became involved, and even beforehand. And the influence of State Auditor Adam Edlin as well. Steve's already mentioned Chief Financial Officer Jack Cornett. And I want to personally thank Health First Board member and member of my staff, Jeff Reed, who has stuck with this project relentlessly from the very beginning of the challenge. And of course, I too want to thank all of the neighboring businesses and residents for their patience and their interest in this project. So congratulations to Health First, and I look forward to seeing this primary care center open its doors next year. Thank you all.
This is a momentous day for Health First Bluegrass. Thank you, Mayor, for being here. Health First is one of a group of safety net agencies. This is not a new concept. There's over 1,250 community health centers across the country with 8,000 individual clinics serving 23 million people. Kentucky has 19 community health centers. The first one was opened in Louisville in 1968. At that time, it was the Park Duval Neighborhood Health Center. And I guess I'll betray how old I am. 3 months after Park Duval opened, I joined them in 1968. I was young then, fresh out of the University of Kentucky. I've spent 17 years in community health centers in Louisville and Eastern Kentucky. And it is a thing that we all believe in. Health First Bluegrass is an agency open to the underserved. Underserved no matter what income. These agencies have gotten the moniker of being for the poor, and they are. Absolutely they are. But the doors are open for the underserved. Anybody who needs quality primary health care can come to Health First Bluegrass. I'm glad that in the waning years of my career, and now that I'm retired after 45 years of practicing pharmacy, that I'm able to come and become a part of mapping the future of Health First Bluegrass. And I can tell you, and I have told them, we have a fine staff of hard-working people. And I have told the team members that I've been on the front lines most of the time that I have spent in the clinics, and I understand their aspirations and frustrations. We have a strong professional board now that gives of their time and their expertise, and we are glad to serve together for this purpose, because we will now proceed to lead Health First to serve the whole Lexington community. And this is why in the beginning, starting with President Lyndon Johnson's War on Poverty in 1964 and the Office of Economic Opportunity, where the health centers began, they called them neighborhood health centers, figured out that they're community health centers, and we hope to serve the whole Lexington community. We have 2 clinics now, soon to have 3. So we want to thank our team members, we want to thank our board, and we particularly want to thank the Health Department board and Dr. Leach for long-term support of this effort. Thank you. God bless.
Well, we're getting ready to shovel some dirt and build a building, as the team would say. I do want to say in closing, thank you very, very much. Thank the team here, and I'll just leave you with one thing. We're talking about a building today, and it's going to be a wonderful, beautiful facility. I think far and away the most important thing is for us to take ourselves inside the building and what really is represented inside the building. What you're going to soon be able to see is you'll be able to palpate the pulse, really, of people who really care for the patients that we serve in this community. And we welcome, as Chairman Herron said, all Lexingtonians to join up with the Health First team. The last thing I mention is when I speak with young medical students, I always leave them with one thought. And that thought is, you know, when you're working with a patient may not know exactly how much you know, but trust me, a patient will very quickly know how much you care.